Let's focus on quadrant number 1, where we start to speak with clients about values. It's important for you to know as a clinician why ACT focuses on values so much, and for you to have a framework as to the importance of values. Values are critical because values tap into our own intrinsic motivation that causes us to do things without waiting around for the energy or the emotion or even the reasoning to take particular actions. Many of us, including clients, oftentimes get in the habit of waiting for energy or waiting for motivation to arrive before taking any sort of actions. ACT helps us understand that values, when we work out of our values or act out of our values, we begin to take action based on what is important to us rather than waiting for a particular emotion to motivate us. Now let's return to discussing how to approach quadrant number 1 with clients. It's going to be helpful to frame this discussion in terms of moving towards their goals and becoming the person that they want to ultimately become. Also, in terms of moving toward a more fulfilling and meaningful life. One of the easiest ways to begin to understand a person's values without asking them the specific question, what are your values, which many clients struggle with, is to ask them who or what is important to them in their life. For the majority of our clients, beginning with who is most important to them is one of the best and easiest ways to get at their values. So I usually begin by making a list of who is important to them. Sometimes the client will immediately begin by stating that their family is most important to them. For some clients, I will have them name the individuals in the family who are important to them and describe some of the characteristics that make those family members so valuable to them. This will be helpful in the future as you begin to draw from some of those strengths and the importance that they place on each of those relationships. After speaking about the family, ask them who else is important to them. Many of them will then state somebody in the extended family, or you may ask them, is there anybody in the extended family that is important to them, such as a grandparent, an aunt, an uncle, a cousin, or other family member. You'll want to ask them about any friends, neighbors, coworkers, or other people that they associate with that are important to them. You can also ask about spiritual leaders, mentors, advisors, or other people that may be of importance to them. To this point, if the client hasn't put themselves on the list, this is a time for you as a clinician to gently suggest that they include them on the list of who is important to them. Oftentimes, clients are so focused on others and who is important to them that they forget that they should actually be at the top of the list. This will be sometimes foreign to clients, so gently remind them that they are among these people who they should be considering as influencing their decision of moving toward their goals and changing and moving toward a more fulfilling and meaningful life. Once you've created that list, let's begin to move towards what is important to them. Be sure not to rush through this particular portion of what is important to them. You're going to need as extensive as a list as you can as you move around to quadrant number 4 above the values list as you speak about committed action. The more ideas that you have and the more ideas the client has about what is important to them, the easier it's going to be for them to identify committed actions that are important that they can begin to act on. I've listed a few items that clients have mentioned to me in the past, such as job, health, pet, spirituality, learning and education, a particular hobby, skill, or talent, or even an object, such as a car, video game, or phone. These lists can go on and on, so be sure to continue to ask what else. Have the client begin to identify other things that might be of importance to them, or even offer them suggestions of areas that they can think about. Once you've identified who is important to them and what is important to them, as a clinician, this is where the discussion takes a turn, where now you're going to explore why each of these things are important to them. This is what helps get at the value aspect of each of these areas. For example, you may begin by asking why their job is so important to them. They may respond by saying it allows them to provide for their family, it is part of their work ethic, or it is part of their responsibility of meeting their financial obligations or helping with the family. Having this discussion with clients deepens their understanding about why they do what they do on a daily basis. Oftentimes, clients and even humans in general often forget about why we do what we do on a daily basis. We merely get in a routine and do what has to be done rather than remembering why we do what we do. This is a crucial discussion that we're going to want to have with our clients because this will explain and set the stage for quadrant number 4. The more you discuss why they do what they do in this quadrant, the better sense quadrant number 4 is going to make to them as you begin to discuss values in terms of committed action and basing committed action off of who or what is important to them. Another way to get at a person's values is to ask them what their family members or even best friends would say about them or admire about them. It's helpful to make a list of those qualities so that as you move around to quadrant number 4, you can also use those values and personal characteristics to frame the discussion about taking committed action based on personal qualities and values. A final way you can get at an individual's values or core characteristics is to explore who they want to become. In a very solution-focused and future-oriented way, have them describe the person that they want to become and what qualities that person embodies. Making that list can be very powerful as you move your way around the matrix to quadrant number 4. Before we leave quadrant number 1, I want to make you aware that there's going to be a certain energy in the room after having discussed who and what is important to the client, as well as having discussed some of their positive characteristics and attributes. This is going to take quite a shift as you move to quadrant number 2 and begin to discuss those difficult thoughts and emotions that have kept them stuck for what has been, for many people, many years, and has caused much pain and suffering and difficulty in their life. So be prepared for the shift and let the client know that the next discussion may be a little bit more heavy. This is an important time to remind them to return to the present moment there in the middle of the matrix and to take a very observing self stance and a non-judgmental approach to looking and analyzing their thoughts and emotions.